Hello, welcome to my online class. My name is Chris, a physiotherapy. Today, I will share with you some knowledge about neurogenic inflammation in musculoskeletal conditions. Perhaps those can help you to have a better differential diagnosis in clinical practice. And for this video, it is for non-profit making educational purpose. If there is any copyright issue, please feel free to contact me. Let's revise some basic concept about inflammation. As you know, when our tissue is damaged, the blood vessels also damage and bleeding occur. Some substance, internal and external substance, internal substance like the dead tissue, and external substance like the bacteria and other external agents in our bloodstream are irritating. So what we need to do, our body need to defend and repair at the same time. That's why histamine, ribosome, plasma, blood clotting, they start the actions, and at the same moment, inflammation happen, and blood vessel dilate, release more inflammatory mediators or red blood cell to help to repair. Therefore, the tissue around gets swollen and it compress and suggest the three nerve endings. That's why we feel the pain. Those are the basic concept. Our body are very smart. Inflammation is a condition we need to regulate. Cannot be too much or cannot be too less because for repairment. So after just mentioned that the three nerve endings are stretched and irritated, the signals is sent and detect and transfer to the central nervous system. Our brain interpreted, and then after interpretations, it send back the signal and asks our body to react to the conditions. The reaction involve both all the motor system, sympathetic and parasympathetic nervous system, immune system, and the endocrine system. Therefore, you know that there are several pathways our brain can regulate the inflammation. Think about it. Do you like inflammation? Yeah. Perhaps our patient they don't like it. I like it myself. Yeah, kind of our business. But indeed, it is good for our body. It is like for example, if your house is damaged, you need some renovation, right? Although during the period of renovation, the process is messy, noisy, and irritating. After that, you get a new one, right? Isn't it beautiful? What we worry actually is somehow if the inflammation is not under proper procedures. Usually, the relationship between the nervous system and the immune system are like this. The nervous system detect and report and instruct the immune system how to regulate the inflammations. So two systems are responsible for the inflammatory process. How about if any one of the party goes wrong? So that causes inflammatory disorder. So we have neurogenic inflammation. There's some problem in the central nervous system and the peripheral nervous system. Or the immunogenic inflammation, as we know, the autoimmune disorders. The basic concept about the neurogenic inflammation. Actually, the our cutaneous nerve, beside detecting the sensory signal and other signal, There is one more function. In the three nerve endings of the cutaneous nerve, they are capable of releasing the neuropeptides, mainly CGRP and substance P. Those neuropeptides are mediators of inflammations. As a result, um, after the release of those neuropeptides, the blood vessel around will get dilated, and all the mediators fiber cell can rush into the area and cause inflammation. Any kind of inflammation which is initiated by the nervous system is called neurogenic inflammation. Beside the cutaneous nerve, the sympathetic nervous system also have a role to regulate the inflammations. As we know, the main function of the sympathetic and parasympathetic nervous system are to regulate the internal environment of our body. Also, it can regulate inflammation by several pathways, both inflammatory or anti-inflammatory one. For example, the TNF alpha and INF gamma in the split cell could be secreted to stimulate the inflammatory process. Those are also kind of initiator or mediators. Tyrosine hydroxylase released by the positive sympathetic nerve pathway is kind of neurotransmitter of the noradrenaline and adrenaline. For its function, it helps suppress the inflammation by making vessel constriction. Also, another kind of substance you may be interested the IL-10, IL-4 from the lymph node cells, which can also suppress or regulate the inflammatory response. Overall, how does the neurogenic inflammation affect our body? For the cutaneous nerve, there is one mechanism. It was proposed as backfiring. For example, if the tissue is injured, the cutaneous nerve is jet. Normally, it should send the signal through the spinal cord to the central nervous system for further action. However, at the moment it releases the signal can be transferred back to the axon to the end part of the cutaneous nerve and cause the release of the inflammatory neuropeptides. This is known as backfiring. Neurogenic switching. Let me make an example. How much do you know about the food allergy? Do you know how it happened and how are the process? Like see a patient just eat some peanuts and then and what happen if he or she has food allergy? You see some skin rashes. But you may know that the food intake to the GI tract and then digest the chemical release and to the enter to the bloodstream and to the peripheral structure, it should take hours according to the digestive system. But some types of food allergy happen very fast. Yeah, actually, it may involve the neurogenic switching process. It's saying that if one side of your body detect the signal, the irritation, and then the signal transmit to the brain, when it responds, the brain actually is not instructing the affected side, but the other parts, other structures or other system of the body. It causes a neurogenic switching. So it is not a very new idea. It was proposed since 1995 and mainly on the skin allergy. That's why you understand Why the inflammations can be stripped from different systems. Okay, let me illustrate the concept again. So the mechanism of inflammation. From this picture, this kind of normal inflammation. If one part of the structures is hurt or infected or being irritated, then the response sent to that particular part of body to have to initiate the inflammation is a normal mechanism. For the backfiring, okay, as you see, this structures is stimulate, and then a signal sent back to the structure at the same time it goes down along the same axon and cause the distal part inflame. Okay, this is known as backfiring. Neurogenic switching. Again, if a part of structure is got injured or stimulated, okay, the signal sent to the brain. However, by neurogenic switching, okay, the response transfer to the nervous system and to another part of the body and get inflamed. Clinical examples. I like this example. Do you know saphenous neuritis? It is a local musculoskeletal problem happen in the knees. Mainly, it happened after the total knee replacement. For example, in our knee middle part, the inner part of our thigh, the middle part, underneath the adductor membrane, the adductor muscle, there is a rectus membrane, and underneath there is a saphenous nerve. Okay, if this membrane or the muscle is get tensed and the nerve is irritated and tense up, the signal from the nerve, the saphenous nerve transfer through the inferior branch and then cause the distal part of the patella inflame. So that's why you can see two conditions. In the OA knee is a general local inflammation that's happened in the synovial fluid and the tibiofemoral joint capsule. However, saphenous neuritis is due to the overuse of the adductor muscle compressing on the saphenous nerve and cause the medial part of the knee inflame. Some palpation, you can feel warm tenderness in the middle possible tibula, and therefore the treatment is to release the tension of the adductors. Also, three other conditions: rheumatoid arthritis, migraine headache, and compressed regional pain syndrome. In rheumatoid arthritis, researchers found that in those patients, they have the condition, the sympathetic nerve fiber trisinate hydroxylin nerve fibers are much less than the usual. Do you remember the function of those? Causing the blood vessel constriction. It's inflammatory regulating nerve fibers. Also, the total innervation of the neuropeptide signaling synovial nerve fibers, also the inflammatory regulating fibers are weaker. In contrast, the substance P positive nerve fibers tend to be more in the rheumatoid arthritis patients. As you can see, in rheumatoid arthritis, is really sensitive to create neurogenic inflammations. In migraine headache, a very common condition, when you think about migraine headache, something wrong inside your brain. Actually, it's more than that. With neuroscientists, they found during the episode of migraine headache, the trigeminal nerve get very hyper exciting, and the trigeminal nerve also have the cutaneous branch, and therefore CGRP are released from the neuron up to 4 to 5 nodes. The consequence is that it causes dilation of the cerebral artery and increase the blood flow and causing inflammation in the dura. And therefore, when you touch and press on the forehead, on the temple region of the brain, you can definitely feel the tenderness if you have migraine attack. And to illustrate the process, I suggest you go for this YouTube video. The animation is really clear to explain it. You can pause it and then have a look first. Compressed regional pain syndrome is a very complicated condition in musculoskeletal setting because the patient have multiple joint inflammation that affect a lot their daily activity and very irritating. Also, it is one of the consequence of neurogenic inflammation because research have found that a high amount of CGRP and substance P are secreted from the different part of the cutaneous nerve. For example, if in the upper limb, those were secreted from the brachial plexus and the peripheral nerve cutaneous nerve endings. Those the axon reflex cause the vasodilation and all the inflammatory response. And especially when you go to the mechanism of compressed regional pain syndrome type 2, it usually involves an injury happen in the cutaneous nerve. So when we know all those conditions, what can we do? As physiotherapy, we have something to do more than just on the musculoskeletal system. We can do something on the nervous system as well. For example, let's more accurate diagnosis, we need to know that not only about the condition, but the underlying pathologies. When we go into the nervous system, as you can remember, basic neuroscience, the C fibers itself are very mechanical sensitive. Under compression, chronic sustained mechanical compression, it will be sensitized. Then the neurogenic inflammation will be initiated. Can you do something on it? Yes, we can. And also, the nervous system is physically inelastic in nature and very oxygen demanding. Lacking of oxygen or under mechanical compression, the nervous system is really not in favor. Can we do something to exercise the nervous system so that it can increase the flexibility and promote transportation of oxygen? Yeah, perhaps we can do something, right? And how about the immune system? Don't miss that. If the patient having the condition as a combination of both neurogenic and immunogenic inflammation, we can do something on both. First, sleeping is important because all the repairment of our body happen in the rapid eye movement stage. The parasympathetic nervous system are very functional at this stage, so therefore we should deal with the patient's sleeping problem to avoid any insomnia and facilitate their sleep. Stress management is very important. Now, stress is much more than something psychosocial because, as you know, If patient is under stress, the cortisol level will increase. Cortisol level really affect the immune system and get the inflammation very excited. So we can do something on stress management such as counseling, exercise, and align with some social help groups for our patients. Environmental modification, diet advice, we can work with our members in other allied health professions. They can provide better help in it. Therapeutic education is important. For example, research showed that the physiotherapy need to input positive and accurate knowledge about the neurophysiology to the patient. Those can reduce their stress and fear to pain and inflammation. That's why the brain, the central nervous system, will get less excited and it really helps. Posture, manual therapy, and exercise are our usual and powerful practice. Keep this. And if you are very keen on the chronic pain management, I suggest you go for some materials about graded motor imagery program. It is a very comprehensive treatment approach that to address all those problems in patients with chronic pain are very useful one. So the take-home message is that in the musculoskeletal condition, try to think more than only muscle or bones. Or try to correlate the story happen in the nervous system, and we will have a bigger scope of practice on it. Those are the reference. Thank you for your time. Any further follow-up questions or discussion, you are more than welcome to contact me, and I will reply to you. Thank you.